Hello everybody, I am Dr. Waseem, physician at Craft Hospital and Research Center, Kodungalur, Thrissur, Kerala. In today's topic, we are going to discuss about pre-anesthetic checkup. Pre-anesthetic checkup is also known as pre-operative checkup, and it includes a set of detailed history taking, physical examination and few laboratory investigations pertaining to the surgery. The goal behind this pre-anesthetic checkup is to assess the patient's or the person who is going to undergo the surgery or any other procedure, whether they are medically fit to undergo the procedure. It is to assess the patient's health condition and also to get to know regarding their previous illnesses or their present illnesses, what problems they are undergoing and what medications they are taking and things like that. It also gives us a gap or a space to discuss regarding their concerns regarding the surgery or anesthesia and our plan and protocols and what will be the post-operative management and care, the duration of hospital stay and things like that. Research has shown that a proper pre-anesthetic checkup or a proper pre-operative checkup has led to decrease in the length of the hospital stay duration, and it also has reduced the death rates in the hospital during the surgery and after the surgery, and also it has helped in reducing the morbidity rates. The type of the surgery involved and the type of the anesthesia care or anesthetic agent or the method of anesthesia which has to be provided is best decided by the surgeon and the anesthetist. I, as a physician here, take care of the medical fitness or the medical opinion part. When it comes to me, it is a detailed physical examination and a history taking and a thorough checking of the drug history. Most commonly, drugs such as herbal medications are supposed to be stopped at least 2 weeks prior to the surgery, and many other drugs such as aspirin, clopidogrel or any other oral anticoagulants like warfarin etc. have to be stopped a particular duration prior to the surgery. Common medications like used for diabetes mellitus and hypertension and dyslipidemia need not be stopped prior to the surgery, but they have to be titrated or they need to be changed to insulins or other medications as suggested by the treating doctor or the physician in the hospital. A common question asked by many patients is that what is the risk behind the procedure or what is the risk behind the surgery? A perioperative risk or the operative risk during the entire period, that is before the operation till the end of the operation, is decided by the type of the surgery, the type of the anesthesia and the patient's previous illnesses and their fitness level. Regarding the type of the surgery, the common surgical complications which we can expect after any procedure or surgery are commonly it is infections followed by respiratory tract involvement and followed by the cardiac involvement. When it comes to anesthetic agent, it is depending on the type of anesthesia and also the dose of the anesthetic agent which has been administered to the patient. The risk of the surgery is classified into 3 types. One is high risk, intermediate risk and low risk. The high risk patients are mostly major vascular surgery patients or patients who are having good lot of fluid loss or blood loss during the procedure, things like that. And also major cranial surgeries etc. can be taken into high risk surgery cases, or even all emergency cases for that matter can also be considered as high risk cases. When it comes to abdominal surgeries, they are classified into intermediate surgeries, that is intermediate risk surgeries, and when it comes to minor daycare procedures, they are classified into low risk or very minor risk case surgeries. Diabetes is a common problem which is involved in most of the patients who are undergoing surgery. So what influence does diabetes have on surgery for a patient? Diabetes can delay your wound healing, it can also lead to dehydration, and it can also lead to any other complications during the surgery or before the surgery like hypoglycemia, hyperglycemia, things like that. So the diabetes or the sugar levels of the patient should be controlled well prior to the surgery, that is either by their oral tablets or insulins or whatever agents which they are on. Prior to the surgery, what we do best is we start them on insulin, and just during the operative period and just after the operative period we keep them on insulin. Once their sugars are stable and we know that the patient is fit to be shifted back to the oral tablets which they have been taken, they can always be shifted to oral tablets. There has been a misconception that once insulin is started, the insulin has to be continued throughout the life. It is not so. Insulin is started for a rapid onset of action and better control. When you take a oral tablet, the oral tablet has its own action. We cannot have control over the tablet, but when it comes to insulin, we can control the dose of the insulin even by hour to hour during the entire operative period and even the post-operative period. So your control lies mainly in the physician's hand and also on the insulin. But when it comes to oral tablet, we do not have any control on the action of the drug, because the drug is already there in your body. We do not know what effect when it will cause. When it comes to a minor procedure, most of them need not have to take insulin if their sugars are well controlled. On whatever tablets they are or whatever insulin they are, it can be continued for the surgery, that is a daycare procedure. For example, for people who are well controlled with dietary modifications and exercise, there is no need of any medications during the surgery or after the surgery as well. So what about the post-op care and what about the pre-op preparation? The pre-operative preparation basically involves alteration in the dosage of the medications or titration of the frequency of the medications. So the patients are put on fasting for a particular period of time depending on the surgery they are involved. Usually they are put on fasting for at least 6 to 8 hours before the procedure. That is to reduce the risk of aspiration, because for example, if you are undergoing an anesthesia which is basically of two types. One is a general anesthesia where you do not have any sensation of what is going on around you, and the other part is a regional anesthesia where you are well aware of the surroundings and only the part or the area which is to be operated is anesthetized. So you have all the awareness of your surroundings, but you cannot feel the sensation or you cannot feel the pain which is being produced during the time of the surgery. But when it comes to general anesthesia, you are fully sedated, you are not under your control, you are under the doctor's control or the medications control. So the patients are put on fluids during the surgery. So because of that, they do not have dehydration or they do not have any loss in their energy. When it comes to a surgical site preparation, we need to clean their surgical site area, and also their bowels have to be cleared prior to the surgery. When it comes to pre-medication, what medications are necessary before a surgery? Definitely before any surgery a patient will be anxious. So to reduce the anxiety, the patient has to be given some anti-anxiety agents, and because of an overnight fasting or a prolonged fasting of 6 to 8 hours, there is problem of acidity. So to reduce the acidity, we give anti-acidity agents by injections, and also you would give drugs to improve the motility of the stomach, so that whatever food particles or whatever acidity or acid is there, it would go down to your intestine and it would get cleared up to reduce the chance of acidity. When acidity develops, there is chance of aspiration during the after the surgery. So that is why these agents are helpful. After the surgery, for example, after a particular period of time, your doctor will advise you to start on small oral sips of water to see that if you are tolerating the fluids. Suppose you are not tolerating the fluids, the doctor would have to take more duration of time for your system to get adapted to the procedure or the anesthetic agents or the anesthesia involved, because when the entire effect of anesthesia goes and when you are back to normal, you can always tolerate your oral feeds very well. Usually it takes nearly 4 to 6 hours for the effect of the anesthesia to go off in general, but there are also procedures where you can also have food very early. Patients are tolerating food very early. So when it comes to a post-operative care, it basically involves monitoring your vitals and taking care of your urine output and all your hemodynamic stability, and it also includes antibiotic coverage if necessary, and good care regarding your wound site and your wound healing and things like that. So the post-operative care and the pre-operative care is a medical teamwork which involves a set of doctors, staff nurses, technicians and many of the hospital staffs. Hence, a good pre-operative assessment and a post-operative care is essential to provide very much good results and better outcomes for the patients. Hope you have understood the necessity of a pre-operative assessment and the essentials of a post-operative care. Thank you.
Craft Fertility Center, caring couples.